Thank you very much, Karen. Good morning, everyone. Like you, Karen, I'm also recovering from a cold, so forgive me while I cough and sneeze through my talk. Thank you very much for being here. It's a pleasure to be part of York Talks. The focus of my work is on an issue that single-handedly fills our hospitals and morgues more than anything else in the world. It lures young people into a lifetime of suffering, addiction, ill health, disability, and poverty. And what saddens me the most, that this is not an act of nature. It isn't an accident. It's actually orchestrated by one of the most powerful and influential industry in the world. Of course, I'm talking about tobacco and tobacco industry. More than 1 billion people in the world currently smoke tobacco, and another 2 billion inhales the secondhand smoke by sharing the same enclosed space with the other smokers, whether they are in their homes, cars, public places, and workplaces. Tobacco kills up to half of its users. So if you have a room with 10 lifelong smokers, unfortunately 5 of them will eventually die because of smoking. The analogy that we often use is the analogy of a revolver with 3 bullets in its chamber. And the chances of somebody dying of lifetime smoking is the same as somebody shooting themselves with that revolver. Smoking kills more than 5 million people in the world every year. That's 1 person every 6 seconds. And this happens because of a number of cancers, most prominently lung cancer, heart disease, and other illnesses directly linked to tobacco, including tuberculosis, which I'll be talking more about in my talk. Another 600,000 people die because of secondhand smoking by inhaling other people's smoke. And that's just talking about the health. The cost of illness in relation to the economy is quite enormous, and that's borne by our health services, our society, our families. In developing countries, one could spend almost a quarter of their dispensable income in purchasing tobacco, obviously leaving very little for commodities, essential commodities like food and housing and other essential things like clothing. If you look at the environment, tobacco growing, tobacco farming is terrible for the environment. It causes deforestation, it destroys livelihoods. It destroys livelihoods of the farmers and tobacco growers. It isn't good for the land either. It actually renders the land incapable of growing anything else for a good number of years. I think I can go on in talking about the harms of tobacco, but I know that I'm in the company of a very learned group of people who are aware of the harms of tobacco. So I'm going to focus more on the issues of low and middle income countries. Unfortunately, most of the smokers now live in developing countries, and naturally the focus of the tobacco industry now is also on the low and middle income countries. Pakistan is one such country. It's a country where I grew up. I received my undergraduate medical education, and I also worked there as a doctor for a number of years. I noticed that in Pakistan, more than 20 million adults smoke tobacco, and sadly, another 500,000 children also smoke tobacco on a daily basis. And that results in more than 100,000 people dying every year. This is an unequal struggle between the rich tobacco giants and the poor nation of Pakistan. As you can see from these figures, that the annual gross national income of Pakistan is less than the profit made by the 6 leading tobacco giants. In countries like Pakistan, tobacco industry play fast and loose. They get a free hand because of the poor and loose legislation, poor governance structures, and being able to directly market tobacco to young people, to women, and making false claims about tobacco. Tobacco industry doesn't stop there. It also interferes directly with the policy-making process by putting out false information, discrediting local researchers, and also they don't stop and they carry on bribing politicians and civil servants as well. Having worked in Pakistan as a chest physician for many years, I saw the suffering and the devastation caused by tobacco use firsthand. Therefore, I decided to focus my work less on clinical work and more on trying to address tobacco use in the most vulnerable group of tobacco smokers, that is patients with tuberculosis. So I'll talk a bit more about tuberculosis now. Tuberculosis is a disease of poverty, and while the bacteria that causes tuberculosis, we call it Mycobacterium tuberculosis, it infects almost everyone in countries like Pakistan. The disease manifests itself selectively in the most impoverished and the most vulnerable people. The combination of TB and tobacco smoking is a lethal combination. What cigarette smoking does is alters the respiratory tract or the lungs' ability to defend itself from infection. So the chances of people getting infected with Mycobacterium tuberculosis are a lot higher if they're a smoker compared to the ones who are non-smokers. The way lungs protect themselves, or the body protects itself from the attack of Mycobacterium tuberculosis, is by forming a ring of cells around the bacteria. Try and isolate it and encapsulate it so that it doesn't spread to the rest of the lungs and rest of the body. Unfortunately, people who smoke, this defense mechanism, this ring formation, the cells that rings these bacteria around it, weakens. And therefore, there is high chances of people developing florid diseases as a result of the infection. If people who were infected and have got TB or tuberculosis continue to smoke, the chances of them dying, not recovering, are higher. The chances of them completing their treatment is also higher, and having a relapse of tuberculosis is also higher. On top of all this, tuberculosis transmission from an infected person to an uninfected person happens more rapidly if they are living in a house with smoking as opposed to a house with smoking restrictions. On the basis of the current smoking trends, it's estimated that tobacco use alone will lead to an extra 18 million TB cases and an extra 14 million TB deaths between 2010 and 2050. Horrible figures, but we put as much as 20% of the total disease burden from tuberculosis down to just tobacco use. So what's the answer? If we could get TB patients to stop smoking, I think we can make a really big difference. Now that sounds very simple, but when I started looking into this back in 2009, there was hardly anybody doing any work in this area. Even the health professionals, chest physicians, doctors and nurses who were treating patients with TB, they weren't really interested initially. They weren't even asking about smoking status, believe it or not. So I started working in Pakistan with the help of a grant from a Canadian development agency who gave us money to do a trial. I started training with my colleagues, paramedical staff who were looking after TB patients, and we were giving them simple counseling skills to be able to encourage TB patients to quit and give up smoking. It was a big trial. We recruited more than 2,000 patients and included about 30 health centers in the province of Punjab, which is the biggest province in Pakistan. And the results were quite amazing. We were able to persuade more than 40% of patients to give up smoking simply by giving them counseling from the health professionals who were looking after them. This was compared to 8% success rate in the control arms, who only received leaflets as opposed to counseling. Now, our findings were quite in contrast with what we normally find with the best available counseling techniques and medication to treat tobacco addiction in the UK or in the US. I think the best results so far we get is up to 20-25% success rate. So this 40% was quite an amazing result. And this happens because the awareness about the harms of tobacco smoke is much lower compared to the awareness that is, for example, exists in this country. So therefore, any information about the harms of smoking, anybody able to talk and persuade people to give up smoking was much more positively accepted than I guess would be the case in other developed countries. Our findings were particularly relevant to low and middle income countries where 80% of smokers now live. Smoking cessation previous to this study was wrongly perceived as a very expensive pursuit, and therefore a lot of focus of tobacco control has been on initiatives like taxation or banning advertising and also banning smoking in public places. Now I accept that these, including a number of these recommended initiatives controlling tobacco, such as banning advertising, increasing taxes, and raising awareness, are valid and needed. But I focus my work most on the group of people for whom these initiatives would come too late, and that is obviously patients with tuberculosis. My team and I have been supported by an EU grant recently to study implementation of tobacco cessation in TB programs in 3 countries, including Pakistan, Bangladesh, and Nepal. This will allow our team, of course, to train a number of health professionals in these 3 countries working within TB programs to be able to offer smoking cessation to TB patients and be able to hopefully save lives in those countries. But I think what excites me the most is that by virtue of this grant, and this is what York is really good at, we'll be able to build capacity of research teams who are based in Pakistan, Bangladesh, and Nepal. By doing that, these professionals will be able to conduct high quality research, obviously supported by University of York, and be able to inform policymakers of which are the best treatments and which are the best options available and the most cost-effective options available for them to be able to treat tobacco addiction and also other forms of addiction. And I mean, York has been doing this with NICE, with the NHS, with the WHO, and now also with these organizations in the 3 countries that our team will be working in. I want to leave you with this image and also with 2 startling figures. One is this $342 billion tobacco industry. This is the revenue. This is how much money has been generated by selling this lethal poison to the poor nations like Pakistan. And the cost of saving life of a TB sufferer, which is only $11. So this is what our research has shown, that it cost only $11 for a health professional in Pakistan to get a TB patient to stop smoking. Thank you very much.